So you mentioned about you are a cash practice. You don't bill any insurance. Can you elaborate on that a little bit?
Yes. So I worked for many years in an outpatient pediatric physical therapy clinic, and just came to the conclusion that I was not in that setting able to provide the best for my patients, and I couldn't walk away from work satisfied. And so now I've decided to do cash pay only. It is certainly limited the clients that I can serve. Different from physicians who can opt out of being providers for Medicare and Medicaid. Physical therapists are not allowed that by this government.
Oh, wow.
And so I have clients come to me that have payment sources through Medicaid or Medicare, and I have to tell them I can't accept their cash. It's against the law.
Right.
And so the people that I provide for through my direct pay services are people that have insurance, people that pay cash only, and now moving into the realm of those companies who choose to forego insurance and pay direct to the provider for their services, for their employees.
Yeah, there's a big move towards that because people, employers, individual patients, they've realized that the insurance makes things more expensive, the quality goes down, and the service goes down. So, many times most times paying up front is a lot less expensive than going through the insurance route. Even if you have a copay or deductible, even if insurance is supposed to cover it, because your copay and deductibles are going to be more than the cash prices. That is just so often the case.
Correct. And the reason that that I see the benefits of paying cash up front and getting these services from the business that I have is that many of the services that I do for these infants, such as the movement imitation therapy and the assessment, if this can be a venue, a road to less disability in that child's life and more function, then the money outweighs, it's you won't have to pay a lifetime of money for those infants, for the medical equipment and other things that you would need if those services weren't provided.
Well, it's kind of like prevention, right?
Most definitely.
Yeah. And I mean, one thing is in our pharmacy, we specialize in a lot of health and wellness type stuff, that prevents people from getting sick. And most insurances don't pay for preventive type stuff, but they'll pay for the sick care stuff over and over and over again. And as a healthcare professional, it's just frustrating to see that. But then it's in my job to educate a patient that, look, you can pay now or you can pay a lot later. That's really the facts.
Right. Yes. And that's exactly one of the things that I promote is you pay now and get the best service and get the best results.